there is a confirmed case of the West Nile virus in Shelby County. Humans get it from mosquitoes, and the symptoms aren't always that easy to detect. 6 News anchor Lori Tucker joins us now for our weekly Caring for Our Kids segment with how you can protect your children.
Kristen, infected mosquitoes carry West Nile and then they pass it on to humans they bite. Well, talking about this with us today is Dr. Katie Stordahl, ER physician with Children's Hospital. And thank you so much for coming in again.
Thank you.
Let's talk about this. How serious is West Nile virus?
The good news is that for most people, it's not serious at all. 80% of people that are bitten by a mosquito that's infected won't even know that they've been infected. 20% may have flu-like symptoms, but less than 1% of people will have any sort of serious illness.
All right, that's the good side. Let's ask this. Why are children at greater risk?
Children actually aren't, and that's the great news. Most people that are infected are 50 or older, and most people that are infected have other complicated past medical history. So they've had a cancer of some sort or they're immune compromised for some reason. So the good news is parents and grandparents are more at risk, but children are actually at less risk.
Very interesting, because I think the popular thought is quite the opposite. We apologize. We're having a couple of audio problems here. We'll try to get that fixed. Let's talk about the signs and symptoms that we as parents need to watch out for.
For children and adults, they're the same. It's flu-like symptoms. Fevers, rashes, swollen lymph nodes, especially around the neck, malaise of just not feeling well, feeling tired, and headache. Those are very general symptoms. So those can be anything from a virus to strep throat to West Nile virus.
Okay, and obviously we want to try to prevent this. Tell us the best common sense stuff that we can do.
Prevention is the key, and it is all common sense. Mosquitoes live where they breed, and they breed in standing still water. So removing water from drains, from old birth baths, from tires that may be left out in the yard, or children's toys. So removing that water is the #1 thing. Mosquitoes are active at dawn and dusk, so trying to avoid being out then, or if you are, wearing something that contains DEET or another type of insect repellent, and wearing long sleeves and long pants.
All right, stuff that we should be doing to avoid mosquito bites in general.
Easy things.
Yes. Okay, thank you. Once again, always good to see you.
Thank you.
We'll see you next time. And if you have a question about your child's health, just email me at ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air.